people have heard the word TMJ, basically, and it's their face hurts or they're having headaches. The number one causes I ask people when they come in, we're doing our initial exam, is basically, have you ever gone to bed without a headache and woke up with a headache? When you do this, this is basically you're clenching or grinding your teeth. When we go to sleep, we're supposed to be restful, and when we wake up, we're restored. Waking up with a headache is not being restored. So that's pretty much a tip-off that you're doing something with your teeth, okay? TMJ is a multifactorial problem. You have genetics, you can't pick your parents, okay? You have how your teeth come together, which is called your occlusion, and then you have your outside environment, what you're doing at that time. So basically, after their exam, we check their jaw joints, their jaw muscles, and how their teeth come together. And then the next step is if they would like treatment, basically, we see to what extent this TMJ and what is causing it. Then we can make them take study models and take a bite registration and a face bow to see exactly how their bite is working. We do a consult and we show them where if you're hitting on one side of your mouth and you're hitting and sliding, pulling the jaw joints out of position, okay? What we try to do, we try to be in harmony. Our body wants to be balanced. So when we grind our teeth, a lot of the times we're trying to find a comfortable place, and we're actually pulling the jaw joints out of position. So our jaw joints and our jaw muscles have to brace the rest of where our teeth are. And we do a chew in an abnormal way because a lot of times we have prematurities or high spots that we're trying to miss while we're chewing. So we crank our teeth forward to try to get out of the way of that. And by doing that, your muscles are working and your jaw joints are working overtime, and this causes the headaches and the soreness. Okay, so we make you a bite splint after we've taken your models, usually a lower bite guard, and we adjust it so until we get rid of 90% of your symptoms in your muscles and your jaw joint, okay? And we use sometimes medications, whether it's ibuprofen or we'll use a muscle relaxant in the beginning. So we get it balanced, and once those symptoms go away and we don't have to balance that bite guard anymore, that we know, we take new models of your mouth and then we see how your bite is. And then we'll sit down and have a consult how we should restore your bite. And it can be all the way from just balancing your bite, which is getting rid of the prematurities. But we would like basically we want CR to make equal CO, which means that your jaw joint, your jaw muscles, and jaw teeth are working in harmony and not disharmony.